Do you want to know more about how you can eat for better health and longevity, and how your diet and lifestyle can play a part in chronic disease? Then you're in the right place. I'm Claire Day.
And I'm Daisy Lund, and we are both plant-based doctors with a passion for improving nutritional education. In this podcast, we will bring you all the latest medical evidence on how a plant-based diet can improve your health whilst being kinder to the planet and fairer to the animals that we share it with.
Twice a month, we bring you interviews from experts in the field with a focus on an important topic related to plant-based health, all while sharing recipes and food ideas.
So, welcome to, in a nutshell, the Plant-Based Health Professionals podcast. Okay, so this week we're here with Rohini Bajekal. Welcome, Rohini. Rohini is a nutritionist and board-certified lifestyle medicine professional and author of Living PCOS Free. Rohini also heads up all the communications at Plant-Based Health Professionals. She's a very busy lady, so thank you so much for your time and welcome to the podcast.
Thank you so much for having me. I'm so excited to be on here.
Hello and welcome, Rohini. It's great to have you, and we want to dive straight in and ask you how you came to be plant-based.
Oh gosh, so the short answer is that it was really kind of my sister that inspired me to make the change, and I was quite young at the time, about 12 or 13, so this was over 20 years ago, and my sister, who was about 9 or 10, initially she'd gone vegetarian because we'd got a dog, and she had made the connection about pigs being very intelligent and caring, and was very confused as to why we were eating pigs when we just got a dog who, she didn't understand the logic. She said, let's go vegetarian. So we all went vegetarian as a family, apart from my father. And a few years later, you can tell that she's now a journalist. She did some investigative digging and made the conclusion that the dairy industry was just as bad, and so went vegan. And this was a time when, 20 years ago, not that many people were vegan. It really wasn't a term that I had known much about. My mum had never really encountered anyone who was vegan apart from her own brother, who'd gone vegan for ethical reasons. But we made the change, and it was a completely different time. We'd go to special supermarkets to get soya milk. You couldn't get plant-based options in most restaurants. It was really tough, and I kind of had some issues with it when I was at university. I had gone from eating quite a healthy vegan diet. I mean, for me, it was very much all about the ethics, and for my mum and my sister as well. But we were forced to pretty much eat home-cooked food because you couldn't get that much vegan food, fast food and things out of the house, which did make it a bit annoying as a teenager, but I didn't really realize that was actually having a lot of benefits for me, both kind of in terms of mental and physical health. And when I went off to university, I ended up having a much more ultra processed diet, relying on things like fast food and sugary soy milk caramel lattes and all kinds of things like that. And I'd also got into kind of binge drinking and typical university behavior. So I really struggled with my health at university, particularly my mental health kind of declined. And I ended up, by the time I finished university, eating some animal products out of the house, mostly dairy. And I didn't ever eat meat again, haven't eaten meat in over 20 years, but I found it very difficult to be vegan. I didn't have a community. I felt like I didn't fit in vegan spaces because I was a woman of color, and I found that they really were not very welcoming, and just did not fit in. And I kind of had a difficult time in my early 20s with accepting my vegan values and kind of not really living in line with my values, and that creates a lot of tension, a lot of stress. So I was always fighting against myself. And it was only later on in my 20s when I decided to study nutrition that I ended up joining the dots again and feeling much more comfortable in my own skin. The world was kind of changing by then, but I always let people know that I didn't really have a perfectly linear journey. It wasn't like I went vegan 20 years ago and then I just stuck with that. I found it very hard socially. People would question me every single time I ate a meal. And I wasn't a very confrontational person back then. I think I've become more confrontational. But when people, you just sometimes just want to eat a sandwich in peace, and people would say, why are you eating this and not that? And why are you doing this? And I always felt like I had to justify every single thing I was doing. So that was sort of the initial reason. And then in my 20s, because of the health issues I developed when I was at university, mostly relating later on to what I realized was polycystic ovary syndrome, I actually found that eating more whole plant foods helped me to regain my health. And so very much now, I'm vegan for the animals, but I also am very lucky that eating that way also benefits my own personal health. And I'm sure lots of other people listening in or who know people who are vegan have found similar things, that certain health issues have improved. And so just, really lucky that it benefits animals, the planet, and our own health.
Don't worry, I think we all become more confrontational as the years go on with it. But our next question was going to be, you mentioned the PCOS. Now, not everybody listening will know what PCOS is. And we did want to hear more about how you use the diet to manage your PCOS and the rest of your health.
Right, I'm so glad you asked that, because PCOS, or polycystic ovary syndrome, is actually incredibly common. It affects at least 1 in 10 women or people assigned female at birth. But we know that it can be in certain subgroups, such as people struggling with fertility issues or people living in larger bodies. It can be as high as 1 in 4. That is just staggering, but people know so little about it, and it's really, it's not talked about enough. So polycystic ovary syndrome, or PCOS, is actually an endocrine disorder. It affects how the ovaries function. So there's actually nothing wrong with your ovaries, but it's an issue with how they're functioning. I kind of think of it as the cousin of type 2 diabetes, and that's because insulin resistance does appear to be the main driver, and at least kind of 70 to 85% of cases. And that's responsible for many of the symptoms that you see in PCOS. It's often thought of as a kind of gynae issue, or often you'll just see PCOS reduced to just being a fertility issue, which really upsets me, because it is it's a common chronic condition that affects every aspect of your physical and mental health, not just now, but in the future as well. It has an impact on cardiovascular disease risk, on mental health issues, such as if you've got PCOS, you're actually 6 times more likely to take your own life. You're more likely to have OCD. Binge eating disorder is the most common type of eating disorder in PCOS, and women with PCOS are at risk of disordered eating and other issues that are rarely talked about, unfortunately, in the doctor's room, mostly due to lack of time, sometimes lack of education, and a paucity of research. So it is, a political issue, absolutely. But it's something that there is hope there. If you have PCOS, it's a complex genetic trait. There's no conclusion on exactly what causes it, which is why it's a syndrome. It's a constellation of symptoms and has a strong genetic or familial link. So if you've got a mother who had PCOS, or a father with type 2 diabetes, people in your family with these issues, then you are more likely to have PCOS. Although we know genetics loads the gun and lifestyle pulls the trigger, as the saying goes by George Bray. So, it's a complex thing, but I want everyone who's listening to know you did not cause your PCOS. You're not to blame for it. And there are lots of people thriving out there who have PCOS. And I was surprised that there are celebrities like Victoria Beckham and Daisy Ridley and people in the public eye who also have PCOS, although it's something that actually even most celebrities don't come out and say, I have this, because it's a heavily stigmatized condition.
And Rohini, can you tell us a bit more about symptoms that you would expect to see?
Yeah, so the most common clinical symptoms that one would expect to see in someone with PCOS are really triggered by the insulin resistance and hyperandrogenism, or high levels of androgens such as testosterone. People often mischaracterize testosterone as a male hormone, but actually it exists in all genders. And it's important to say that, because some of the language that's used around PCOS just adds to the stigma. You're told you have a male hormone, you've got male pattern baldness, that you are obese. I mean, these things should not be used in a judgmental way or leveled against people with PCOS, because societal beauty standards, patriarchal and racist beauty standards already make it hard enough if you're living with PCOS. So I think language really matters. And a lot of my clients say to me, they remember years ago when they were given the diagnosis, they were told they could never have kids, or something sticks in their head and it's carried with them for many years. But some of the symptoms will be things like excess hair growth in places you might not want it, so along the jawline and chin, acne that is quite resistant sometimes to treatment, so cystic acne, painful nodular cystic acne, that doesn't go. And it's sometimes really frustrating to be in your 30s or 40s with acne. You think you're done with all of that as a teenager. And weight gain is actually a symptom of PCOS. And that's why it's so unhelpful to tell someone with PCOS, just go away and lose weight, because it's something so many people have tried to do, but without actually giving people the tools on how they can try and manage their symptoms. So weight gain is one, particularly, visceral fat, or the fat that unhealthy type of fat that collects around the organs. If you gain a lot of weight around your stomach area, that can be a symptom. And having kind of sugar cravings, again, a sign of that insulin resistance. Scalp hair loss is common in PCOS as well. So that can be really distressing, because all of these things are signifiers of female beauty when you're losing that. And obviously one of the most common symptoms and one of the criteria is irregular or absent periods. So there is actually a strict criteria for PCOS that was set in 2003, and it's called the Rotterdam criteria. And you need to have 2 out of 3 to be diagnosed with PCOS. I hit all 3 criteria. And if you're a teenager, the criteria is a bit different. And we've got a whole chapter about that in our book, Living PCOS Free, but you can get a diagnosis in teenage years as well. It's a diagnosis of exclusion. So as you, Daisy and Claire, know, when you get a patient, you're kind of ruling out things like Cushing's syndrome and hypothalamic amenorrhea, and you're looking for these symptoms. So the first one is irregular or absent periods, and anyone who's menstruating and not on hormonal birth control, or not breastfeeding, or not pregnant, should be having a cycle that's between 24 to 35 days. And that doesn't mean 24 days one cycle, 35 days the next, but regular predictable intervals. It's really important, because your periods are a vital sign, just like your blood pressure or your heart rate. And then the second criteria is clinical or biochemical symptoms. So you might have things like an altered LH and FSH ratio. You might have signs such as prediabetes. You could have high testosterone on blood tests. There's lots of different tests, and that's what your GP or your provider can help with. And then the clinical signs. So as I mentioned, that, jawline acne, the weight gain, the fertility issues, irregular periods, all of those sorts of things. And there's so many other lesser known symptoms that we talk about in our book, and things like sleep apnea, which hardly even gets a mention. That's when your breathing stops and starts when you're sleeping. So there's so many different things with PCOS. And then the third one, which I think probably gets so much attention, is actually the ultrasound diagnosis, which is having and they've changed the criteria recently, so you need to have at least 20 follicles per ovary to be diagnosed with PCOS, and it looks like a pearl necklace on an ultrasound. These are not true ovarian cysts, but they're kind of immature follicles, and that's why there's a lot of discussion actually this month about renaming PCOS to reproductive metabolic syndrome rather than polycystic ovary syndrome, because a lot of people think they've got these gigantic ovarian cysts. And you can have ovarian cysts and have PCOS, but they're not really connected. They're 2 distinct things. So I think there's just a lot of confusion around it, and that makes getting a diagnosis hard. It takes on average 7 years or so, and it's similar for other women's health conditions like endometriosis. The average time for diagnosis is 8 years, and you can have concurrent diagnoses. About 5 to 10% of women with PCOS will also have endometriosis, or they could have fibroids, they could have other things. Pain is not a symptom of PCOS. Some women with PCOS do have painful periods, but it's really important to emphasize that, because it's not a painful condition in that sense. If you've got severe cramps, then you need to get checked out for other conditions.
Rohini, can I ask you about the teenagers you mentioned? Because often teenagers do have irregular periods, they may have some acne, and when is that just normal? Could that be PCOS?
Yeah, so we know that it often starts in teenage years. That's when PCOS really tends to kick off. And it is common for periods to kind of take a while to settle and for cycles to take a while, maybe especially in the first year or so. But when they kind of continue beyond that, and if they've got those signs of hyperandrogenism, those are all warning signs for PCOS. So they do need to go and get a full evaluation because it can be really distressing. I remember when I was a teenager and I actually went on the pill for that reason, because I was, a strong student, and I knew that would really impact me if I was doing my exams. I could come on my period at any moment. So it can be really life enhancing to take medication such as the pill. And that's why, as a health professional, I'm very pro lifestyle medicine. Lifestyle medicine works alongside allopathic medicine. Not everyone can manage their condition entirely with lifestyle and diet changes. And that's really important for PCOS because the first line of treatment is lifestyle modifications. And that surprises a lot of people because they think, lifestyle, isn't that a bit woo-woo, changing your diet? No, that's actually in the national and international guidelines. And we need to get that message out because lifestyle plays a role for every single person with PCOS, whether or not they need medications on top. They may need fertility help, or they may need metformin or something like semaglutide if they're struggling with weight. So there's lots of different options out there, but lifestyle is always key, and it needs to be part of the discussion.
Yeah, I mean, we obviously totally agree on the podcast, but you hear quite a lot of people say, oh, my healthcare provider just stuck me on the pill and didn't do much else. What could we be doing better with managing PCOS once we've made that diagnosis?
I think it's just about education. It's for the patient to really be in the driving seat, for them to understand what's happening and what are these things kind of telling you. Is your body sending you a message? And it's important to emphasize that, yes, absolutely, the pill is one of the best treatments for PCOS, and it can really help manage that cystic acne and the hair loss that can be so distressing and rob your quality of life. But at the same time, we need to educate people about what is PCOS, what are the long-term health implications. They may not even realize that some of their symptoms are connected. They may be going to see a dietitian for weight management. They may be going to see a personal trainer to try and lose some weight or get fit. They might be seeing an endocrinologist because of their uncontrolled sugar levels, and no one's joining the dots and saying, actually, this is PCOS. And I know myself, I spent many hours going to see dermatologists and trying antibiotics before I really realized what was going on. So I think it's just having that multidisciplinary approach, being able to cross-refer to other health professionals and giving the patient hope that, no, okay, if they want to have a child, most women with PCOS do go on to have a child. If they are struggling with their weight, there are so many options. Whilst I think it's so great to have more awareness about what's happening, and I'm a big fan of people tracking their cycle, and it's really important when you go to see your doctor. Probably one of the first questions you ask some of your patients is, when was your last period? If you're going to spend 5 minutes rooting around in your diary trying to figure that out, then that's 5 minutes of precious time that's gone. So I think it's great to have awareness about that, but we also shouldn't rubbish amazing things like the pill, which have so many benefits beyond just contraception. It also reduces the risk of a number of cancers if taken for a number of years, particularly womb cancer, endometrial cancer, which we do know that is the most common cancer in women under 35 with PCOS. So some of these benefits are profound. And as I mentioned, for me personally, it really helped me manage a lot of the symptoms of my PCOS. I was on the pill for over 10 years, and it enabled me to sail through my exams at school.
That's really good to know, actually. And in terms of sort of lifestyle advice, we have very short consultations with patients. What could we do to actually best use that 10-15 minutes, and how can people get the best from their healthcare providers?
I'm so glad you asked that, because I think we have to be cognizant of the incredible time pressures that are there, and you cannot be doing an entire kind of look at someone's food diary or something in that session. So it's all about giving someone just a starting point. So I know some GPs have referred the book that I wrote with my mother, Living PCOS Free, or just free podcasts for people who don't want to buy a book. Or sometimes I suggest, if you've got a friend who has it, maybe you could lend it to all your friends. We also have a brilliant PCOS fact sheet that's totally free to download on Plant-Based Health Professionals. And we have a number of other fact sheets as well. So I think those sorts of free resources can be a really great starting point, and going for evidence-based resources, things like the ESHRA guidelines, NICE guidelines, those things which, you know, we know are going to be rock solid evidence, rather than maybe following your favorite wellness influencer. That being said, I do obviously talk about PCOS online, and that's why it's important to follow people that do actually link to studies and can back up what they're saying.
Brilliant. And we'll link some of those suggestions in the show notes so people can look those up and share those with their patients and with their friends and colleagues. Rohini, can I ask you a little bit about hormonal health in general? Say someone hasn't got a PCOS diagnosis, but quite often will feel that their hormones are just out of whack, or they don't feel quite right. Maybe it's a perimenopause or a menopause or a thyroid issue. Is there any evidence about how to eat for hormonal health? I know that's quite a broad question.
Well, yeah, absolutely. So firstly, it's understanding that this applies to not just women. It can affect absolutely all of us. And we know that plant-based diets work for hormonal health, they work for cardiovascular health, thyroid health, everything is connected. And it's luckily the same diet. I'm going to come on this podcast and say, right, you all need to go keto. We know that eating a diet that is rich in whole grains, fruits, vegetables, beans, nuts, seeds, and herbs and spices is the most beneficial dietary pattern, and is particularly anti-inflammatory and fiber-rich for people living with hormonal health conditions such as PCOS or endometriosis or fibroids. And we have the science to back that up. We have thousands of studies that emphasize that, and that includes foods such as soya as well. But we know that in PCOS, those foods are particularly beneficial because they actually tackle the root issue of the insulin resistance. And having fiber-rich foods also means that the glycemic load, which means the level at which kind of a food makes blood sugar rise, is also lower. So eating intact whole grains is something I recommend. So things like oat groats or steel cut oats, quinoa, barley, brown rice, red rice, rather than white rice, white bread, most of the time, is really beneficial. And I'm a big fan of beans and lentils, which are rich in complex carbohydrates, protein, and other micronutrients. So I do suggest that, you know, if you've got PCOS, to really focus on fiber, focus on plant protein, because we know that can be incredibly satiating. And that goes really well with some of the other recommendations. I'm a lifestyle medicine professional, so I always bring in a discussion about other aspects of our health. So strength training, we know that helps with glucose disposal. And you mentioned things like perimenopause and menopause. We also become less insulin sensitive as we get older generally, and in the hormonal changes and the perimenopause can particularly affect that. And for those of you who maybe don't have the medical background in nutrition, then just to emphasize that insulin is the hormone that regulates blood glucose or blood sugar in the body, and it's quite a complex process. But the more insulin sensitive we are, the better, in a way, because that allows the cells in our body to use blood glucose more effectively, and that reduces blood sugar. So we can actually use the energy from the carbohydrates that we eat, and less insulin is needed as a result. And hyperinsulinemia in PCOS, that constant over kind of production of insulin, drives a lot of the symptoms that I already mentioned: the excess hair growth, the acne, the fertility issues. So we want to be mindful of that. And that's really important in perimenopause and menopause as well, because we do tend to steadily put on weight between the ages of 25 and 65. You know, we know most of the population is carrying excess weight. And whilst I always prefer to focus, rather than saying to someone, you need to lose X amount of weight, I prefer to focus on the behavioral change, because so many people have tried different diets. And even a plant-based diet, if it isn't approached the correct way, can also be carried out as another fad diet. That's why it needs to be sustainable. And for me, you know, if you're vegan, then you have your why, it's for animals. But for someone living with PCOS, it could be something different. It could be that they'd like to have more energy to be able to exercise or take that walk, or they might have a milestone. Maybe they want to have a baby, or maybe they would love to feel confident in their own skin and in their body. So it's just knowing your why. And I think that makes making dietary changes a lot more sustainable and beneficial as well.
That's really great to hear, because you often hear people worried about carbohydrates, particularly if someone with PCOS has been diagnosed as pre-diabetic or having impaired glycemic control. And people tend to, like you said, go keto or try to stay away from carbohydrates. What would be the advice there?
So I would say that with ketogenic diets, it's like putting fuel on the fire when you've got PCOS. you can have a plant-based ketogenic diet, although I'm not a fan of that, as I already mentioned, because we know that people with PCOS are at risk of disordered eating, and that would be a very restrictive diet. You need to basically be eating like avocados, chia seeds, and coconut oil. It just would not be sustainable. You'd barely be able to eat out with friends or go on holiday or do anything. So carbohydrates are the body's primary fuel source. That our brain needs carbohydrates to function, and unfortunately we've conflated carbohydrates from all sources. So the carbohydrates from beans are very different to the carbohydrates found in simple sugars like jam. And it's not that one is good or bad, but it's understanding how they fit into our overall dietary pattern. And I am conscious of the language I use with my clients without saying things like this is bad food or this is a good food. It's looking at the food that is going to bring about optimal health, that's going to be sustainable for the planet. And so looking at foods that you can add in is a much more empowering way. So if you're having cornflakes with milk, could you switch to steel cut oats with blueberries, some cinnamon, which we know can help with glucose regulation, and it can actually help a little bit with sugar cravings anecdotally as well. Flaxseed, which we know is super high in fiber and really rich in lignans and really beneficial for hormonal health. We know that fiber traps that excess estrogen. So we know that being constipated actually makes you hold on to all of those toxins and extra estrogen. So going to the bathroom regularly should be a goal for everyone. Between 1 to 3 times a day is really important. So those things give us a good insight into the person's health. But yeah, carbohydrates are absolutely key. We know that taking carbohydrates out of the diet, if you've got PCOS, and we know from looking at similar studies on type 2 diabetes and things, that actually increases the risk of cardiovascular disease, of stroke, of other associated health issues at which people with PCOS already have a higher risk of. So why would we cut out health promoting foods that are so rich in fiber? And a lot of women do that. So they might be having just a Greek yogurt for breakfast, some salmon at lunch, and chicken breasts with greens for dinner. That is not a healthy or sustainable dietary approach. That's not providing enough calories, enough micronutrients, and it harms fertility. We know that carbohydrates are really essential. You can actually, if you've got lean PCOS, which does affect 20% of people with PCOS, so that was kind of the situation I was in. I'd never had excess body weight really, but I was in that kind of category. If you have lean PCOS, you can be extra sensitive to carbohydrates being removed. And some women with PCOS oscillate between PCOS and hypothalamic dysfunction. And you can end up losing your period if you end up kind of restricting carbohydrates, restricting whole food groups. Dairy and meat are not food groups. They are not essential in a diet. You can get all the same nutrients from plant-based foods. Of course, I recommend everyone supplements with B12. If you're on metformin, then you do need to be especially mindful of having enough B12. And metformin's a common off-the-label insulin sensitizing agent that's used in PCOS management. And if you're on the pill, I recommend a good multivitamin, multimineral supplement. And generally for people with PCOS, you should be having enough vitamin D as well. And that's true for all of us. The government recommends everyone should supplement with vitamin D between September and April. But if you've got conditions like thyroid issues, or you're having terrible PMS symptoms, or you've got PCOS, then I would say look at your vitamin D levels and make sure you're getting enough. And especially if you've got darker skin like me, or you're carrying extra weight, vitamin D is really key. We know that women with PCOS have lower vitamin D levels as well.
Oh, this is all excellent advice. Can I ask one last question about PCOS? Inositol, quite a few patients ask me about that.
Yeah, so inositol is actually a naturally occurring substance in many plant-based foods. So it's a component of things like beans and greens and things like that, and it's found in plant-based foods. But women with PCOS, again, have been shown to have lower levels of that. And so I always recommend a food first approach, because we don't have large scale trials on inositol. We have some promising initial research on looking at kind of a good ratio of myo-inositol to d-chiro-inositol is 40-1. But we just don't have large enough studies. And I've seen a lot of protein companies and other companies jumping on this trend of creating inositol supplements. I'm sure if I launched one, I'd get a great business from it, but I'm just not keen to do that whilst we don't have those large scale trials. So I think if you're trying to conceive, it can be potentially be something that can be added in, but especially if you think insulin resistance is kind of an issue. But I would never recommend adding in a supplement like inositol without making those fundamental changes to your diet and lifestyle. You're just not going to see the results. So there are lots of supplements out there like berberine and inositol and magnesium and lots of different supplements. But if you're not going to make those changes to your patterns of movement, what's on your plate 3 times a day, your stress levels through stress management, that's such a key component for PCOS because there's a high level of cortisol dysregulation in PCOS. If you're still drinking alcohol or smoking or things like that, that's going to be something that no supplement can negate the toxic effects of. So supplements are there to supplement your diet and lifestyle. And I know this because I have spent money on supplements, some which have been ineffective. I see clients all the time who are taking 20 supplements with PCOS. They're desperate for anything that can help. And it's the same for other hormonal health conditions. You just walk into some of the big stores and you'll see lots and lots of supplements marketed to women with PMDD, PMS, perimenopause, menopause, and it can be a minefield for the person out there trying to figure out what actually works. But yeah, that's sort of my take on inositol.
Amazing. Thanks, Rohini.
One quick supplementary, steel cut oats.
Yes. What about steel cut oats?
Well, I mean, so would I recognise them in the supermarket?
So you do get them in some supermarkets, but they are one of the more niche ones that are better to get from things like a bulk food store or online. But all they are the whole oat groats. So that has everything, including like the endosperm, the entire grain, the whole grain. And a steel cut oat is just that chopped in half. They use a steel cut blade, so you can't forget the name. And it's often called pinhead oats as well. And it's just slightly quicker to cook than oat groats. I sometimes use oat groats as well. And I also combine them with other grains. I think so many people, we just rely on, wheat, rice and corn, but I try to add in millet and buckwheat and other things like that into my diet. And they can be really helpful if you are gluten-free or you're just trying to diversify the grains in your diet. So they can be added into your porridge, just like the way that you would cook steel-cut oats. But they have a higher amount of fiber. They're a good source of protein, nutrients like manganese, magnesium, calcium, iron. It's a great food to add in. And all you need to do is just cover them with water the night before, and then you cook them for about 10 minutes on the stove while you're chopping up your fruit and you're getting your nuts and seeds and stuff ready for your porridge. And I batch cook them and eat them for the whole week, so I don't have to think about it. And I sometimes use them to make overnight oats and other things like that. But just for making the simple switch from rolled oats to steel cut oats, I've had clients lose weight. I've had them improve their energy levels, feel fuller from breakfast, have less snacking for the rest of the day. And it's just simple tips like that make a huge difference. And adding more diversity to your diet is going to benefit your gut microbiome. We know that from the American Gut Project, that adding in 30 or more different plant foods a week can be really helpful. So that's sort of, my number one tip to people. Just bring in as much color, as much diversity as you can. Look for the things that are on offer or on sale. There are great options in the UK. There's a small business called Hodmedod's, which grow a lot of their own pulses and grains in the UK. So good to support small ethical suppliers when you can.
Okay. I think the answers are going to be very similar, but I wanted to know, can we ask you about any specific dietary guidance we could give for people suffering with anxiety and depression? You mentioned that there's a really high rate of anxiety and depression in people who have PCOS, but what about more widely? What's the advice there?
So I think the advice around anxiety and depression is, again, it's complex. There's so many people struggling with mental health now, and it's not just saying to someone, just change what's on your plate, is simplifying it and not really being compassionate towards their issues, particularly if they're usually probably stemming from things beyond their circumstances. It could be financial and a cost of living crisis. It could be being a carer and having burnout. There's lots of different reasons, and it can be endogenous as well. But I think we've got to be really careful with the way that we talk about food and mental health. And we certainly don't have hard data that you can reverse severe depression from doing X, Y, and Z. We know that for more mild cases of anxiety and depression, changing what's on your plate can be particularly beneficial. So adding in more fiber-rich foods, more colourful foods, rich in phytonutrients, and particular micronutrients that can be beneficial, like magnesium. So making sure that you're eating a colourful, whole food, plant-based diet certainly can't do any harm in terms of reducing inflammation. But if someone is feeling depressed or anxious, then maybe meal prepping and self-care is the lowest thing on their list, and actually going out and having a meal with friends is what's going to lift them up far more than meal prepping for 2 hours and making a whole food plant-based meal. So it's looking at things holistically and giving them that support. We know that changing what's on your plate can help with reducing levels of neuroinflammation, so inflammation in the brain, adding in colors of the rainbow of all different kinds of food groups, and reducing ultra processed foods, which we know can certainly worsen the issue, cutting out things like processed meat, and getting more omega-3 rich foods, so lots of flax seeds, chia seeds, maybe adding a DHA EPA supplement can be beneficial. So that's sort of my take on it, that certainly there are certain foods that I would suggest if someone's having kind of mild issues, such as maybe they're having a case of SAD in the winter, adding in more of these foods could be beneficial. And I'm a big fan of dark chocolate for that, but I certainly wouldn't go out there and say dark chocolate is the antidote to all depression and anxiety. I think that mental health issues, just like all chronic conditions, are far more complex than just do this and you're going to reverse this condition.
Thank you. Now, we're big fans of soya products on this podcast, and we go on about tofu a lot. But in the context of men's and women's health, there's been various controversies. So are there any groups of people who simply should not be eating soya for any reasons at all? Can you tell us something about that?
Absolutely not. So we know soya is safe for all genders. Obviously, if you're a tiny baby, then you shouldn't be having kind of soya milk. You can have soya formula, and that's been shown to be safe. But from the age of 1, you can offer, and from 6 months, you can offer soy milk in foods and things like that. And generally, all ages can benefit from having soya. We know that there are societies around the world, such as in East Asia and China and Japan, where soya has been consumed for thousands of years and has so many different health benefits. Soya is not just about the phytoestrogens. There are so many other benefits of soya-rich foods, particularly minimally processed soya foods, so edamame beans, tofu, tempeh, soy milk, because these foods also have fiber. They're rich in calcium and iron is the most common nutritional deficiency globally. It's the most common nutritional deficiency among women, and so it's really important to get those foods in. And if you're a man, there's no indication that will negatively affect your hormones or have a clinically relevant impact on testosterone levels. And there's actually dozens of randomized controlled trials and meta-analyses showing this. So don't take my word for it. There's actually, there was a review in 2022 of 417 observational studies, clinical studies and systematic reviews and meta-analyses. So showing that having phytoestrogens did not impact levels of testosterone, estrogen, sperm or semen in men. I made a note of that. And there's the only 2 examples that were ever detrimental. There were just 2 case studies of 2 men having large amounts of soya. And there was one man who was having several liters of soy milk every single day, about 14 cups worth. And they came to the doctor with kind of small amount of breast growth, but they were pretty much probably cutting out all other food. We don't really know what else they were having, but they were having just liters and liters of soy milk. That is not something we'd recommend anyone doing. If you had a bag of 30 carrots a day, you'd go slightly orange as well. So it's all about having a diverse whole food plant-based diet. But aiming for 2 to 4 portions of soya every day appears to be something that's really beneficial. I probably get 3 or 4 portions of soya most days. I have soya milk for breakfast. I have tofu or tempeh at least once a day or twice a day. I'll add edamame beans into stir fries, and I'll have soy yogurt with a couple of dates and blueberries for dessert. So I do have quite a lot of soya myself, and it's amazingly healthful food, and all the major nutrition and dietetic organizations like the British Dietetic Association and the American Academy of Nutrition and Dietetics all say that soya is beneficial. So I think that, yeah, we have the science there. We have thousands of studies that come out every year showing that soya is beneficial and healthful. And it can also help in PCOS with ovulatory dysfunction. So it can actually help with ovulation rates and fertility. It can help with weight management. Again, it's a very nutritious food. So there is no reason to cut out soya. And I really don't want people to cut out lots of things from their diet. It ends up making for a very restrictive and unpleasant, unhappy life. So, if it's a whole food, plant-based diet, eat a variety of whole grains, eat a variety of beans. If you like other beans, definitely add those in. Don't feel that you only have to have soya, but soya is just such a versatile and rich source of protein. It's a great source of all 9 essential amino acids. I really want everyone to add it into their diet, unless they're allergic, but that's only 0.3% of the adult European population, whereas we know that at least 70% of people globally have lactose malabsorption. And I was just in Asia, where actually it's up between 90 to 100% of East Asians have lactose intolerance. So the real issue is the lactose intolerance, not the soya. But yes, if you are allergic to soya, then I actually have a whole fact sheet on plant-based health professionals about what to do if you can't have soya and you're following a plant-based diet. And I just tried chickpea tempeh the other day, which was delicious. I've tried buckwheat tempeh, and I've had edamame, and it's something that was edamame free. It was another type of tofu that was made from another type of bean. So there are lots of options out there, and there are obviously lots of different beans and lentils. So there's no need to avoid being plant-based just because you can't have soya.
You didn't say that the buckwheat tempeh was delicious.
Oh, I loved it. It was delicious. I love buckwheat. Buckwheat is a great pseudo grain and really rich in so many micronutrients. I add that into my porridge as well in the morning, and it's great to add into grain bowls and things like that. So it's all those things are very quick to cook. I think people get nervous about it, but if you've got an instant pot, then you just bung it in there. Or I like to soak grains before to reduce the phytic acid content and make them more digestible, because I do get a little bit more bloated. A lot of people with PCOS do struggle with bloating and IBS symptoms. So trying to kind of heal your gut microbiome by adding in fiber gradually, adding in a diverse mix of plants, fermented foods I'm a huge fan of. So things like sauerkraut and kimchi and coconut water kefir and soy yogurt and Indian foods like dosa and idlis. These are all fermented, and when I'm eating them at home, my dad makes them. They're incredibly healthful. When you go off to an Indian restaurant, you have a masala dosa. It's definitely more of a treat, but it's still super delicious.
Sitting here as GPs, I think both me and Daisy have drawn a bit of a blank when a patient has said to us, look, I'm taking levothyroxine. I've been told I'm not supposed to eat soya.
So I'm actually on levothyroxine myself. I also have a thyroid issue, which is really common in PCOS. There's a higher rate of subclinical hypothyroidism in PCOS and issues around that. But there's a lot of confusion around that. Initially, when I was put onto it, I did my own research and kind of read what the studies show. And actually, we know that there is absolutely no contraindication. We know that they do compete for the same receptors, so you need to space it appropriately. So that you're advised to either take levothyroxine last thing at night before you go to bed, providing you don't eat dinner too close to that time, or first thing in the morning. And you need to wait half an hour before having any kind of coffee or food. Ideally wait a couple of hours. And we know before you have soya foods or foods that are rich in fiber like walnuts, to wait at least an hour or two. So I would suggest having your thyroxine, brushing your teeth, getting ready, having a shower, and then enjoying your breakfast after that. And if you are worried or you don't want to have a lot of soya in the morning, then maybe having a pea milk or another option for your breakfast, and then having soya for the rest of the day. But there's no reason to avoid it. You need to leave a 1 to maximum 2 hour gap. That's what the studies show if you're on thyroxine. So there's no need to be concerned about it. And obviously there's a really growing rate of people with thyroid disease. We know that most people with autoimmune conditions are women. And one of the key things to mention is making sure that you've got enough iodine in your diet. So iodine is something that you can get from plant-based sources such as nori, a few sheets of nori every day, or seaweed, but the amount in seaweed can be quite variable, and some seaweeds can be toxic. So I'd much rather someone takes 150 micrograms of potassium iodide as a supplement every day. And I'm really glad to see that some plant-based milks are also adding iodine into their formulations as well, because the UK is quite an iodine deficient country. So we just need to be mindful of that micronutrient.
I just want to say at this point, we love talking to you so much because we're learning so much here, but you're not going to get this kind of consultation from your GP, that's for sure. And a lot of people aren't going to be able to afford to see an enlightened nutritionist such as yourself. So what tips can you give for people in terms of getting their own resources and getting this kind of advice on the cheap beyond what we've said in the podcast? Where would you direct them to?
I'm so glad you asked that, Claire. So this is why I do what I do at Plant-Based Health Professionals UK, and I'm so happy that I found Shireen and the whole team, and really kind of friends like family there at Plant-Based Health Professionals. So if you're a health professional and you're listening, you're thinking, how on earth do I get this message to my patients? Then join Plant-Based Health Professionals UK, learn and educate yourself and empower yourself with this information. And if you're a patient, then we have thousands of free resources, articles, this incredible podcast that we've been so excited about, but also fact sheets and blogs and other resources. So come and make the most of these incredible resources that are at your fingertips that cover so many different health conditions. And I've gone through quite a roller coaster with my health this year, stuff that I'm still kind of processing and navigating myself. And I know what it was like to feel so vulnerable as a patient, and also having some issues that I wasn't getting all the answers to. And the key thing is to really advocate for yourself, empower yourself with evidence-based information. You don't need to have a nutritional or medical background to be able to do that, but ask intelligent questions. Make sure that you keep all your medical record in one place, write a detailed history of the issue, and be clear about what you want to get out of the session. If you go into the session and you're throwing everything into that, it's going to become a big mess. So just get really clear on what you hope to gain from that and have those answers at your fingertips. Know when your last period was, know what medications you're on and what the dosages are, know what your family medical history is. If you don't know what your mother's periods were like, go home and ask your sisters, ask your close relatives what their menstrual cycle was like. You need to know, because some of these things can take years to pick up otherwise. And we know that 70% of people living with PCOS don't even know they have it. That is awful. That means 3 out of 4 people with PCOS are walking around not realizing that all of their struggles are due to this condition, and all of this is connected, and they could be getting so much more support and help out there. So I would say to anyone who's feeling overwhelmed by where do I start, then there are so many free resources and podcasts and similar organizations around the world. There's Plant-Based Canada and lots of different organizations locally that are doing things, and it can be a great way to get support if you're new to this and you don't even know how to add in more plants to your diet. It doesn't need to be all or nothing. I really do recommend taking your time, empowering yourself with the knowledge and the science, and making it delicious and fun and sustainable for yourself. So that's why I do so much free advocacy and educational stuff. And with PCOS, I'm always doing free talks, podcasts, trying to kind of answer every single question that gets into my inbox, because I've had some amazing messages from people. I've had people that have been able to regain their period after 5 years of not having a period with PCOS, people who've been able to conceive after years of trying, people who say that living PCOS free gave them more information than their health providers did in years. And that's due to, it's complex. I think we can't ever blame that one thing. It's the whole system that we're living in. It's really, really difficult to be able to give everyone everything.
Well, yeah, it's been an amazing resource for me to recommend. It's certainly made my consultations about PCOS a lot easier, just being able to recommend your book. Have you actually been able to get it into public libraries?
Well, we've tried. It is really difficult to do that. I've gone and taken copies to places and left them in a few surgeries in different places, and I'm always telling people to go and borrow. And sometimes if I have someone message me, I will actually just send them a copy. And I think it's also a lot cheaper on kind of as an ebook or a Kindle as well. But as I mentioned, almost all the resources are available for free on my mother's site, nithibajekal.com. On my website, rohinibajekal.com, I have a lot of resources. I also launched a free newsletter that's every fortnight, and I provide lots of tips around PCOS, around managing it, because I always want to give people that support. I always share the latest research as well, because there is gradually a trickle of new research, but there is a lack in women's health, and we are trying to change that. It's high time, really, because this is something that's affecting so many people.
Can I just say, Rohini, thank you for all the free resources and the advice, but you come across as obviously so knowledgeable and such an expert in this field, but also very compassionate and caring yourself, having been through your own journey with hormonal health. And if people did want to come and see you, are you seeing patients? How can people find you? Where can they consult with you?
Absolutely, yeah. So I do see clients one-to-one in my practice. I'm also going to be launching a group program for PCOS Awareness Month in September. So I'm always very busy. I never thought I'd go on like national TV and talk about how I have excess facial hair, but I did. And it was, it's so important if you're in a position of privilege to use that and to share your stories. And I think as a health professional, I always share my story as much as I can with people, because people think you have all the answers as a health professional, but actually we're all trying to navigate it. Almost everyone is. And I think it's actually really important to me as a vegan to make that clear as well, because having a plant-based diet is the number one thing that's helped my PCOS and my overall mental and physical health. I cannot believe how much I suffered when I was younger with a lot of these issues and how much they improved from changing my diet. However, at the same time, I want to emphasize that if you have PCOS, if you have other health conditions, it doesn't make you less of a vegan. It doesn't make you less worthy. And we need people of all shapes and sizes, with different health conditions, with everything under the sun within the vegan movement. And it's really important, because I do see a lot of like ableist and unfortunate kind of language that's used in online vegan spaces at times. And I think just being compassionate, we all need to remember that's the reason why many of us went vegan in the first place. And that's certainly, the what veganism is all about. It's just understanding that people are at different points in their journey. And I have definitely found that just by showing people how joyful this way of eating and living can be, that's the best way I've been able to impact change. I have had most of my close friends go plant-based or vegan after spending time with me, and my entire family is vegan, including my in-laws, one of whom, my father-in-law, is a dairy farmer. So it's possible, but leading by example and with positivity is my number one message, I think.
That's really fab. Yeah. And I think we're quite joyful about what we eat, Claire. We'd like to finish off with asking you what you're going to eat. So we can't let you go without...
The joy. Yeah. Bring the joy.
Absolutely. So
I'm actually briefly staying with family at the moment, and my whole family, we love to cook. In fact, a whole bit of our book in Living PCOS Free, we have over 30 whole food plant-based recipes that are oil-free and naturally, most of which are gluten-free as well, just so that they're as accessible to people as possible. So my mum, my dad, we all just are huge foodies in this house. And I think my mum's made a massive dal makhani, which actually translates as kind of a butter dal, and it's a really decadent food in North India, and it's made with a lot of ghee, which is clarified butter or really oxidized cholesterol. It's not a healthful food, ghee, but it's something that's prized in Ayurvedic medicine. And of course, it's not vegan. We made a completely plant-based version and using a little bit of vegan butter for the creaminess, served with red rice and lots of coriander and lemon juice and tomatoes, and all of that vitamin C also helps with the iron absorption from the lentils. So just a fun fact there, always pair your vitamin C with iron rich foods. So it's totally possible to enjoy your cultural foods on a plant-based diet. I come from South India, my family's from South India, and I love Indian food, and I've been able to enjoy plant-based versions of all my favorite dishes. Luckily, there are tons of plant-based dishes in Indian food, and that's true in many cultures around the world which have prioritized plants and been plant predominant. So get inspiration from other cultures is what I would say when you're starting off on this journey, but don't feel you have to give up your culture or your religion, or it's totally possible to take part in festivals like Diwali or Eid or Christmas and actually be vegan or be plant-based, I certainly make some tweaks sometimes. So I will add in extra greens into my meals or other things when I'm doing things when I'm eating at family friends' houses or I'm celebrating. But I always think it's important to have a joyful relationship with food, eat mindfully and intuitively, and don't lose that joy, because it's very important to nurture that positive relationship with food. But so that's what I'm having for dinner, and I always just try and mix it up every day. But one thing I do try and do most days is to get a salad in. So before I have dinner, I'll usually start with a big bowl of rocket leaves, tomato, cucumber, and depending on how much time I have, I'll add in lots of other things like beetroot and fennel and carrots and other things. But that's non-negotiable for me. I always like to start with something vibrant and packed with fibre.
So that sounds absolutely amazing, and I think we feel a bit dwarfed in what we're about to say, don't we, Daisy? But what are you having for dinner tonight?
Well, I'm just going to go and make a hummus, actually. But I'm going to pair it with a big salad as well, like you, Rohini. This is our sort of Friday night. It's Friday night, by the way, so we might not be releasing this on a Friday. But this is our sort of take on a Friday night takeaway. We have a big flatbread with hummus and salad and falafels and chili sauce and like you say, lots of coriander. So it's our healthy take on a flatbread takeaway.
I love hummus.
How about you?
Oh, I think I've got some friends staying, so I think I'm going to do a sort of a one pot tray roast, and I've got a butternut squash, cauliflower, some red onions, and you sort of put some nutmeg on there and then roast that for about 30 minutes, add your green lentils. Some sage is still going bonkers in the garden, so I'm going to add some sage to that, add some spinach, and then what doesn't go well with a tahini dressing, so to get the tahini, the lemon juice and the mustard, and a bit of sweetener, maybe a bit of maple syrup, and pour that over. I've also got some pomegranate seeds in the freezer that are really easy to add out of season. You know, you can just sprinkle them on there, and some chopped nuts of some sort as well. And that'll be quick, which is what I'm aiming for.
Sounds great. I tell you what though, Claire and Rohini, I bought amaranth for the first time after our episode on iron.
Great.
I haven't made it yet.
Oh my God. Amaranth is what I did my entire dissertation on, and it's one of the most climate friendly crops. It can grow in like a drought. It literally grows like a weed in parts of India, and it's called Rajgira there, and you can make amazing amaranth desserts. I make amaranth porridge. It tastes incredible with like some pecan nuts and plant-based milk. It's really, really delicious. And if you've got any kind of date jaggery or anything like that, it can be like a really nice sweet porridge. That's kind of a traditional Indian porridge.
Oh, amazing.
Huge fan of amaranth.
I'll try it this week. I'll report back.
Yeah, but we've certainly got to up our game with the porridge, haven't we, after this episode? I thought I was doing well with the jumbo oats, but it needs more.
I know. Well, my dad does like a 5-grain porridge, and I thought I was good. And then he was like, I've put teff in here. I've put 5 types of millet. I'm like, what is happening? So yeah, I think I guess it's always just about like being open and trying new things when you go plant-based, isn't it? You're always learning, you're always discovering. And I think people just get so much more into food when they go plant-based. That's what I found. Like my husband did not like food before when we first met, and he wasn't vegan. He just was not into food, and now he can talk about food without dying of boredom. And he's actually really into it. And I think that happens to a lot of people. So yeah, it's one of the best outcomes.
Absolutely.
Fantastic. All right, so I think we can wrap it up then. Thanks so much for talking to us. We've learned so much, and I hope that we'll be able to parcel it into our 10-minute consultations somehow, but otherwise we'll be directing people to this episode.
Thank you so much, Rohini. It was really fantastic speaking with you today. Thanks for coming on.
Thank you for having me, and I hope everyone who's listening will go and check out the other episodes as well of In a Nutshell, and share this with someone who has PCOS or wants to learn more about their hormonal health.
Amazing.
Bye-bye.